Thank you everyone for attending this public workshop to discuss draft proposed amendments to Rule 1210, Toxic Air Contaminant, Public Health Risks, Public Notification, and Risk Reduction. Before we begin, please note that Spanish translation is available and Ms. Marcela Mioto will discuss the details.
Buenas tardes y bienvenidos a este taller público donde se hablará sobre la norma o regla 1210, riesgos para la salud pública de los contaminantes atmosféricos tóxicos y la notificación pública y reducción de riesgos. Este taller va a ser ofrecido también con interpretación simultánea al español. Si están utilizando su computadora portátil o computadora de escritorio, favor de localizar el icono con figura de globo en la parte inferior de su pantalla cuando este aparezca en un momentito y van a seleccionar Language Interpretation y luego Español. Si están sintonizándonos desde su teléfono, iPad o dispositivo similar, busquen el menú con los 3 puntitos en la esquina superior del lado derecho de su pantalla y pulsen Interpretación de idioma y luego Español. Si se olvidan de las instrucciones, las van a encontrar en el chat. Muchísimas gracias y que disfruten.
Thank you. My name is Randy Constellation, Associate Engineer with Rule Development at the district. Other district staff joining me on the panel today include Deputy Director Mayani Luther, Chief of Engineering Mohsen Nazemi, and Senior Engineer Jim Sweeney. To help with time, we ask that you please hold your comments and questions to the end of this presentation. During the question and answer session, you may relay your comments via 2 options, the raise hand and chat icons. I'll go over those again at the end of the presentation. Next slide, please. This is an overview of today's presentation, background on Rule 1210, an ongoing rule development process. We'll discuss the Rule 1210 proposal, next steps, what to expect after today's workshop, and we'll take your comments and questions at the end of the presentation. Next slide. Before we discuss the draft proposed revisions to Rule 1210, it is critical to understand the importance of this rule. The California Air Toxic Hotspots Program has 2 main objectives. 1, to protect the public right to know about air toxic emissions and how these emissions can potentially impact public health. And 2, require health risk reductions for facilities with elevated health risks. Rule 1210 was adopted in 1996 to implement the Hotspots program. The rule establishes limits at which facilities that create toxic air emissions must notify the communities around these facilities and reduce health risks. Next slide. The rule development process for Rule 1210 was initiated in May of 2019 when the district's previous governing board directed district staff to 1, evaluate the current toxic air pollutant significance threshold adopted by the district under Rule 1210, 2, implement a regulatory process to amend Rule 1210, which includes industry and community partners, to obtain input on and analyze reducing the toxic air pollution significance threshold with the intent of improving public health. And 3, return to the board with a proposed amended rule no later than April 2020. The district conducted public workshops, the first in August of 2019 and the second in January of 2020, to discuss draft proposals for Rule 1210 as directed by the board. In March of 2020, the District Advisory Committee, under the previous governing board, was asked to consider supporting the proposed amendments to Rule 1210, which included lowering the cancer risk reduction threshold from 100 in 1 million to 10 in 1 million. The Advisory Committee recommended further analyses and for the district to return to the board with proposed rule amendments in approximately 1 year. In July of 2020, the district returned to the board to request an extension. the board approved the extension with a new deadline to evaluate Rule 1210 of October 2021. At this time, I'd like to turn the presentation over to our Chief of Engineering, Mohsen Nazemi.
Thank you, Randy, and good evening again, everyone. Welcome to the district's Rule 1210 proposed amendments workshop. District Rule 1210 currently establishes public notification and risk reduction thresholds for different types of health risks, as shown in this slide. The threshold for public notification and risk reduction apply to health risks that are resulting from air toxic emissions caused by operation of a stationary source. Stationary sources are facilities that operate equipment that emit toxic air contaminants, such as coating operations, engines, power plants, factories, and landfills. Public notification is a core element of the program as it ensures the public's right to know about possible health risks from exposure to air toxic emissions from facilities, stationary sources. And then the risk reduction requirements involve the development and implementation of a plan to reduce health risks, and facilities subject to the risk reduction requirements must submit a plan to the district proposing changes to their process to reduce the health risks. As an example, a facility can propose to install like a control device to reduce toxic emissions, or propose changing the use or location of material containing toxic pollutants. As it relates to the cancer risk threshold, District Rule 1210 currently requires public notification when the potential cancer risk from a stationary source is equal to or greater than 10 in a million, but the risk reduction is not required unless the potential cancer risk is equal to or greater than 100 in a million. This results in often notifying the public about an elevated cancer risk without any corresponding risk reduction requirements. For all the other health risks, the existing rule has the same threshold for public notification and risk reduction. And as you can see, for acute and chronic non-cancer health hazard indexes, those are 1, and for cancer burden, it's also 1. Next slide, please. Before we discuss the proposal for revisions to the cancer health risk requirements under Rule 1210, it's important to discuss what the cancer risk represents. The health risk calculated under Rule 1210 represents the highest health risk for an individual living or working or attending school near a stationary source. So it estimates the likelihood that an individual will develop cancer during his or her lifetime and expresses the probability of occurrence as chances in a million. So as an example, a cancer risk of 100 in a million indicates that a person has an additional risk of 100 chances in a million of developing cancer during his or her lifetime. We have the next slide, please. Thank you. The cancer risk thresholds of 100 in a million in Rule 1210 only includes the risk associated with exposure to air toxic emission from a single stationary source. However, as you know, the overall cancer risk includes cumulative risk from exposure to other sources of air pollution, such as other stationary and mobile sources, or other factors such as genetic background, health, and lifestyle choices such as diet, smoking, or alcohol consumption. The California Environmental Protection Agency, or Cal EPA, estimates that the average cancer risk from breathing pollutants in the ambient air in California over a 70-year lifetime is estimated to be about 760 cases in a million. This estimated cancer risk includes all sources that contribute to air pollution, including mobile and stationary and other area sources. Additionally, Cal EPA estimates that the overall cancer risk in the United States to be about 250,000 cases in a million. And this estimated risk includes all external factors that contribute to cancer risk, such as air pollution, genetics, lifestyle choices like diet, smoking, or alcohol consumption. Next slide, please. This slide might be a little hard to see, but this is for comparison, shows a map of all 35 local air pollution control districts in California and their respective cancer risk reduction thresholds. San Diego is actually one of California's 5 largest air districts, along with the South Coast, San Joaquin Valley, Bay Area, and Sacramento air districts. Out of these 5 largest air districts, which are actually identified in this map with solid bold borders, San Diego and San Joaquin are the only districts that have 100 in a million as the threshold for cancer risk reduction. Bay Area and Sacramento have adopted 10 in a million as the cancer risk reduction threshold, and South Coast has a risk reduction threshold of 25 in a million. The districts shown in the map with dark blue are all the ones that have 10 in a million cancer risk reduction thresholds. Next slide, please. The district published the proposed revisions to Rule 1210 on July 9th, and the main revisions I'll cover tonight include lowering the cancer risk reduction threshold from 100 in a million to 10 in a million, enhancing the public notification and risk reduction protocols and establishing public meeting requirements, and revising the existing extension requirements for facilities that cannot reduce the cancer risk to below 10 in a million within 5 years. I'll go over each of these changes to explain how these revisions can bring benefits to air quality and public health. Next slide, please. As previously discussed, the District Rule 1210 currently requires public notification when the potential cancer risk from a stationary source is equal to or greater than 10 in a million. But it requires health risk reduction from these stationary sources only if the potential cancer risk is equal to or greater than 100 in a million. This proposal includes lowering the cancer risk reduction threshold from 100 in a million to 10 in a million, which would result in the following benefits. Establishes a health protective limit at which stationary sources would be required to reduce cancer risks. San Diego County does not have any stationary sources presently that exceeds the existing risk reduction threshold of 100 in a million. Therefore, the existing threshold is ineffective as it does not apply to any facilities in San Diego. It also reduces the chances of contracting cancer by tenfold, which can bring significant health benefits and costs associated with those health benefits to communities located around the sources that create elevated health risks. Furthermore, it aligns the cancer risk notification threshold, which is currently 10 in a million, with the risk reduction threshold. It's unacceptable to the public to provide notification about elevated health risk and then at the same time inform them that there's not going to be any requirement to reduce that risk. And finally, makes the risk reduction threshold consistent with 11 other districts in California that have already implemented 10 in a million risk reduction threshold. Next slide, please. So some of you who participated in our annual air toxic hotspots report public meeting, you are familiar with this map. In accordance with state law, the public notification and risk reduction requirements under Rule 1210 apply based on the results of an approved health risk assessment that's conducted by the facilities. Per state law, the district requires health risk assessment based on a screening tool that we use here at the district. And this map shows all of the facilities that are currently required to conduct a health risk assessment based on the screening tool that we use for cancer risk. There are 30 facilities in San Diego County that are required to conduct health risk assessment based on their cancer risk screening tool. The health risk assessment is what quantifies the health risk and consequently establishes if a facility is subject to public notification or risk reduction requirements. Therefore, up to 30 facilities could potentially be impacted by this proposal of reducing the cancer risk reduction threshold from 100 in a million to 10 in a million. However, based on the health risk assessments that have been submitted to the district by these facilities, less than a quarter of these 30 facilities would be subject to the risk reduction threshold of 10 in a million. Most of these health risk assessments are still under review at the district. And previous workshops conducted by the district that Randy referenced on August 15 of 2019 and January 30th, 2020, the district discussed multiple threshold options, including 10 in a million, 25 in a million, and 50 in a million, as well as maintaining the existing 100 in a million threshold. Today, the district is proposing a 10 in a million cancer risk reduction threshold due to the reasons we discussed in the previous slide and the number of facilities that will be subject to this proposal. Next slide, please. So the revisions to Rule 1210 also propose to update the public notification protocols, including requiring a public meeting for all sources subject to public notification with the cancer risks of equal to or greater than 10 in a million threshold. This will also streamline and enhance the public notification process. Also, the proposed amendment clarifies that extension of time to reduce the health risk below risk threshold can be granted if reducing the risk is not technologically or economically feasible. Next slide, please. This slide shows kind of the timeline for public notification process. The additional enhancement to public notification process that are proposed as part of this rule are, as shown in the slide, that currently facilities have 45 days to submit a public notification plan to the district after being notified about that requirement. That this proposal includes changing that to 30 days for submittal of the public notification plan. Additionally, the district currently has 30 days to review and approve the public notification plan. And then the facilities have 30 days to complete the public notification. This proposal also changes that 30 to 15 days for both the district's review and approval of the plan and for completion of the public notification. The existing timelines were established back in the early 90s when this rule was adopted. With current communication avenue, we can shorten these timelines to streamline the public notification process. Also, the existing rule does not have specific requirements for public meetings. This proposal includes specific requirements for public meetings, so facilities know what to expect. Public meetings are critical for the process of, as health risk assessment are important, but very complex subjects, and the public generally has difficulty to understand this. By providing public meetings, there's an opportunity for facilities to engage with the communities and for the district to explain the risk and to answer any questions from communities impacted by elevated health risks. Next slide, please. The other element of the rule is the risk reduction plan. As it relates to the risk reduction plan protocols, Rule 1210 currently require a risk reduction plan within 6 months of receipt of written notice from the district. This proposal changes that risk reduction plan requirements to 120 days to expedite the risk reduction process. Next slide, please. Also, the existing Rule 1210 requires facilities subject to risk reduction requirement to reduce their health risk within 5 years, but it also allows for extension under certain circumstances. This proposal includes revisions to enhance the requirements related to extensions. The proposed rule requires reducing the cancer health risk to 10 in a million within 5 years to the extent that is technologically feasible and economically practicable. Technology is still advancing, especially as it relates to electrification. Therefore, it is important to have avenues to evaluate what is feasible both technologically and economically to ensure operations can contribute benefits to our communities and continue that process. So at this point, we will turn back to the Randy for rule development team to discuss the next steps. Thank you very much.
Thank you, Mohsen. Please submit written comments by close of business on Thursday, August 19th, which is 2 weeks from today. The public notice for the workshop was issued by the district on July 9, thus providing a comment period of slightly more than 40 days. A workshop report with district responses to questions and comments received will be prepared and distributed to the workshop attendees and other interested parties. The anticipated timeline for the report is within the next 2 to 3 weeks. If you didn't already provide your email address when you signed into the workshop, please contact Janet McHugh to receive a copy of the workshop report. Her email address will be shown on the next slide. A socioeconomic impact assessment, SIA, will be prepared per state law. The California Health and Safety Code requires air pollution control districts to perform an SIA when adopting, amending, or repealing rules and regulations that will significantly affect air quality and emissions limitations. Toxic emission rules, such as proposed amended Rule 1210, don't lend themselves to the typical cost-effectiveness analysis used for criteria pollutants, such as ozone precursors, for example, oxides of nitrogen and volatile organic compounds, because doing so would necessarily require the district to assign a dollar value to a health outcome avoided. For example, cancer incidence, death, hospitalization, or a developmental disability. In addition, some risk reduction measures may not result in any emission reductions. Consequently, a calculation of emission reductions and cost effectiveness expressed in dollars per pound of emissions reduced cannot be estimated. The total costs of the proposed amended rule are uncertain because actions taken by affected facilities will depend on the health risk assessment results and on the actual risk reduction measures and associated costs that may be implemented and incurred by facilities per their respective risk reduction plans. Due to this uncertainty, the district will be presenting in the SIA general estimates of the risk reduction measures and associated costs by major facility type or activity. The district will submit the proposed rule for consideration of adoption by the current governing board on October 14th, 2021. Next slide, please. And here's my contact information along with Angela Ortega-Fish, Rule Development Supervisor. As was mentioned during the previous slide, please contact Janet McHugh to receive a copy of the workshop report. Her email address is listed below. So at this time, we'd like to open the session to questions and comments. Please click the raise hand icon located near the bottom of your screen in order to be recognized and be given the opportunity to speak. You can also click the chat icon near the bottom of your screen to type in your question or comment.
And thank you, Randy. I was going to also mention just for those folks who may not have had time to jot down or copy the email addresses, maybe Janet or someone can type in all these 3 emails into the chat so everybody can see them.
We have a comment in the chat or a question.
Yes, the question is, will the 30 facilities mentioned be notified and will hospitals be affected by this ruling? So the answer is yes. Those 30 facilities have already conducted a health risk assessment and they know what their health risk levels are, but this proposed amendment will be and has been actually shared with permit holders in the district. And so they have already received the draft proposal. And hospitals are could be actually one of the facilities that have to prepare health risks. I don't believe we have any in the 30, but hospitals, if they're in the impacted area, will also be notified about the health risk by facilities that are subject to the notification and risk reduction. And I'll invite Miney and Jim and others, if they like to add to anything that I say, please feel free to jump in.
Yes, I think, certainly those facilities will be notified. We'll be publishing a list of those facilities soon on our website. If these facilities do have an elevated health risk, they get notified with the applicable requirement, whether it's a public notification or the risk reduction requirement.
So another comment in the chat says, from Brian says, this sounds like a good idea. What can we do to encourage the adoption of the rule change? I think the purpose of this public workshop, Brian, is to get input from the public, and you can certainly provide comments in writing to the district related to this rule. And I think Randy mentioned that we will take this proposal to our governing board for final adoption, and that will be done through a public hearing process. So the public is welcome to attend that hearing. And if you have any comments, whether it's support or oppose, you can present that to the governing board at the time as well. And the governing board would ultimately decide on the approval of these proposed amendments.
Diane, you can mute yourself.
Thank you. Can you hear me?
Yes.
Thank you. Well, just wanted to thank you all for this workshop and for your consideration of this rule change. I'm Diane Takborian with Environmental Health Coalition. We're supportive of consideration of this change and appreciate the work that you've done to analyze what the changes would mean and how the rule might impact the community and impact the affected businesses. I had a few comments and questions in relationship to the public notification section to start with. And first to say, we appreciate and think that it's a good option to add the community meeting requirement. And I'll say a few things about that in a second. But on the public notice, what we did notice is that the notice requirements didn't change that I saw. Perhaps I missed it for how the notice would occur. It appears that it's still through direct mailing. And we wanted to see if you could consider other kinds of technology for notification, because obviously people communicate very many ways nowadays. So we had some ideas about that in terms of obviously email, phone, automated calls, text, social media, which can actually be targeted at specific zip codes or even more targeted than that. So that's a question as to whether you've thought about that and whether or not you'd be open to that. I think the others are how the notices, where else the notices would go. And we noted that healthcare facilities, I don't believe, are included in sensitive receptors. I know hospitals are, but not community clinics and places like that probably should receive the notice, as well as elected officials at every level. and potentially community planning groups and other government recognized organizations. So I'll stop there. I have some other questions, but if you want me to keep going, I will, or perhaps you want to respond to those.
Thank you, Diane. That's very helpful, and the public notice is actually the most important part of this because it protects the public right to know about toxic emissions. The intent of the rule is to notify the community members or the public workers, schools, other sensitive receptors that are impacted by a facility's health risk. So anything that we can do to enhance that notification process, we are open to getting comments and input into that. In terms of notifying elected officials, actually the district has a practice of doing that. If for example, a facility is located in a supervisory district or in a city, we reach out to the county supervisor and the city council members and mayor to office to make sure they are also aware of that. Because once these notices go out, constituents contact their elected officials and ask about these things. So it's better for them to hear it directly from us ahead of time before they get calls in from the constituents. And as far as healthcare facilities, I think that's a good comment. We will take a look at that. And I don't know if there was any other things you wanted to cover. Maybe we can get to your other questions.
Okay, thanks, Moisa, I appreciate that. And I didn't know that you notified them, so that's great to know. You're exactly right. They would get those calls, so good that they would be notified. And that kind of moves to the public meeting because hopefully everyone, including elected officials, would participate in that, and then they would have more information should they be contacted. I did want to ask some questions about how the public meetings would be organized, because it seems that the industry that is required to notify would also be required to set up the meetings. But I noticed that you talked about potentially developing a framework for the meetings. And I think we just want to encourage APCD to do as much of that as possible. I think what we've learned through the AB 617 process is it takes some time to kind of get a way of communicating with the public and having an effective public meeting, including, as you're doing tonight, interpretation and public notice and potentially childcare if it's an in-person meeting, those kinds of things. And it just seems like the district is getting a good routine with that, and that we could ensure that these meetings are done appropriately for the public if the district were to be organizing it. So I just wanted to add that as well and get your thoughts about it. And those are my comments. Thank you.
Oh, thank you very much. Yes, the public meeting is also an important element of the public right to know. And even though the rule requires the facility to hold these public meetings, I think the district has also played an important role in conducting these public meetings, and we work very closely with the facility to ensure that district also is a participant of the public meeting and provides for how the meeting agenda be set up, how the presentation should take place in terms of what the risk is and explanation of some of that. But it also provides an opportunity for the facility operators to directly communicate with the community members and explain any type of operational factors at their site and what kind of mitigations they're implementing to further reduce the risk from their operation. So it does give that opportunity to the facility operators as well. And so for those reasons, I think the district does play a pretty significant role in these public meetings and will continue to do that. But thanks for your comments. Appreciate it.
We have a comment in the chat from Brian S. To further Diane's verbal comments, I would suggest that the notices also be posted on your website along with the affected area.
Yeah, Brian, we've been doing that. It's posted on our website. Also, Assembly Bill 423, established that by December of this year, we posted all records related to health risk assessments and public notifications. So we're going to expand the documents that we post on our website. But for now, we do have a map, that shows the facilities that are subject to these requirements, public notification, risk reduction requirements, and we do publish the public notifications on our website currently.
And it's an interactive map. So if you go to our website, you can actually find out a lot more information about each facility. There is another comment from Ali. Does this lowering of standards include dry cleaners? Dry cleaners, as you all know, use solvent called perchloroethylene that is also a toxic compound. And therefore, there is a risk associated with operation of dry cleaners. The state law provides for certain approaches to industry-wide sources, such as dry cleaners, gas stations, and others. So it does not require individual dry cleaners to notify, but there are provisions that allows the district to publish some notification about the risk from certain types of industries and the range of those risks. And those are, again, referred to as industry-wide sources that are subject to these requirements. So, but individual dry cleaners, no, they're not required to, they're not subject to these standards here.
Okay, we have a few people with their hands raised. Sarah, would you like to speak now? Thank you.
Yeah, so I appreciate you taking my question. Thank you very much. I heard in the outset that one of the original reasons for the delay was to allow the district to do more analysis on who would be affected. And it sounds like you guys have landed on this pretty much the same number of facilities as when this was first proposed. But I'm curious about, there seems to be a little bit of a disconnect between that and the list of facilities that you have on your website as still pending HRAs. I think that was in the range of around 70 or 80 facilities that still have outstanding HRAs. And I think that there are also facilities that have submitted emission inventories for the first time and probably haven't really fully gone through the prioritization score. So I'm kind of wondering if you can address this disconnect in terms of how do we really know how many facilities are going to be impacted with there are still so many HRAs outstanding?
Thanks, Sarah, for your question. Very good question. Actually, I think I went over this, but maybe I went over it fairly quickly. The changes that we are proposing here for this Rule 1210 only applies to the cancer risk and not the other non-cancer health effects. So some of those facilities that you mentioned may have had to do a health risk assessment due to non-cancer, acute and chronic health effects. And those thresholds are not being changed at all. So the ones that are impacted by this change are the 30 that we mentioned during our presentation.
So you're confident at this point that you've identified everybody and you've done HRAs for everybody that needs to be evaluated? Because when I looked at your hotspot report, it looked like a lot of folks still had elevated prioritization scores for cancer. And I guess I'm just very concerned that we're going about this without really understanding the full impact. And I'm not really sure that I see the analysis that was sort of promised kind of at the last workshop. So I'm trying to understand what's different and what new information do we have in terms of how many facilities does this really affect and what are the costs?
So Sarah, just to add to what Molson said, we did complete the prioritization scores for all facilities up until 2019. And, we have requested the health risk assessment from these facilities. And the vast majority of these facilities have submitted the health risk assessments to us. I think there are a couple of facilities that haven't done that, but, they should be in the process of, completing the health risk assessment. We will certainly publish the list for those 30 facilities that we're referring to. Again, the 30 facilities, it's only the facilities that are requested to do a health risk assessment due to cancer risk. So, obviously we have other health risk assessments that were required based on acute and chronic. But, for the purpose of this discussion, we're focusing on the facilities, they are triggering based on the cancer risk. So we'll go ahead and publish this list as well as the health risk that has been reported to us by the health risk assessment that was conducted by the facilities. So, I think that, the data that we have is up until 2019. Obviously, if these facilities in San Diego County, if they go through changes, they might not be subject now to the rule, but they might be in the future. Or they might, make changes to decrease emissions and consequently cancer risk and no longer be subject to this rule. But, we do have, current data at this point that tells us who would be subject to this rule.
Is it possible then that the list on your website is outdated because it's still showing that quite a number of HRAs are still outstanding?
So I'll take a look at this list that you're referring to. Is that the list that related to the hotspots report?
Yes, correct. And I guess my only point there is I just, want to be certain that the analysis that was requested was actually done. And so do we actually know what the impact of this rule change is, how many businesses it'll affect? And then the second part of that is, have you done sort of the cost assessments that were requested in that initial analysis?
So, I think that, we certainly know the facilities that would be subject to this. I'll take a look at this list that you're referring to see, the hotspots report that they were for previous years, right? So it would be data that, that we published there, that were for 2019 and 2020. But, I think that we definitely have a comprehensive list of facilities that might be subject to this. Again, what established the requirements is the health risk assessment. In terms of cost analysis, as Randy mentioned before, and maybe he can go over that again with regards to the cost effectiveness for this, because you're talking about the health risk, the cost effectiveness for this rule looks a little bit different than a cost effectiveness analysis that we would do for a prohibitory rule. So,
understood. Yeah, I definitely understand that, but I believe he also said that you would present the associated costs by facilities or activities for compliance with this rule as part of your next steps.
Randy, could you please, revisit this topic based on, the update that you provided, just to make sure it's clear?
Oh, yeah, sure. The challenge that we have in regards to doing a cost analysis, it doesn't translate very well like we would normally do with criteria pollutants. It's not the same. It's not an apples to apples comparison. So our approach is basically to provide a range of expected costs and think of it as not actual costs, because those are uncertain. We don't know what a particular facility will do in order to reduce the risk. It all depends on their approved risk reduction plan. So there's a lot of uncertainty on our part as to what steps the facilities will take, what emission reductions there will be, if any. So because of all these uncertainties, we have to take it to the approach in the rule to minimize the risk to the maximum amount feasible. That's the approach of the proposed amendment. And as such, the only thing that we can do in terms of a cost analysis right now is to provide some type of range in cost again, it's going to be specific to the type of industry, just in terms of the potential controls that would be added, to give some idea of if they had to install these controls to lower the risk, these are the anticipated costs for that industry.
Yes, that's what I understood you to say. So I guess I'm trying to understand how did you arrive at that cost, and is that information is available to us now?
We're still in the process of working on the SIA, so it won't be available until it's ready to go to the board. So that's kind of where we are at the moment.
Okay.
Yeah,
Thank
and
you.
again, it's important to point out that we are not talking about emission reductions only. We're talking about risk reductions. So there are many approaches that the facility can take to reduce the risk, and it's not just to reduce their emissions. And therefore, the cost can be completely different. And I'm seeing comments in the chat box about what about the cost of healthcare that's posed by increased risk. And that's another good point that you should look at. Another comment says, why can't we do the economic analysis like ARB did on diesel engines, ATCM? And again, diesel engine ATCM was very specific control measure that applied only to diesel engines. And there's technologies for diesel engines that can reduce the risk, like diesel particulate filters. So it's not the same as looking at the overall facility-wide risk. So that's the reason that these socioeconomic analysis that Randy is referring to is not as straightforward as just a single source risk reduction or emission reduction strategy. Thank you, Sarah, for all your comments. Yes, Angela.
Yeah, I'm sorry. We also have one comment in the chat that didn't go to everybody. It's from Dell Jones. Are there specific industries that will be considered first as this moves forward?
Oh, thank you. There are several types of industries that would be subject to this risk reduction. As we look at the final approved health risk assessment results, it varies. It's not just one type of industry that is going to be subject to this. So depending on the facility's operation, emissions, and their overall risk, then it could vary from one type of industry to another. But when we publish our data that we have so far, I think you can see which facilities are, based on their health risk assessments, are above the 10 in a million threshold, and that can give you an idea of what type of industries. But no, we're not going after. This is different than the federal EPA program where they develop a maximum achievable control technology, or MAC standard, for each industry. Same with the state program, the ATCM, that it's developed for each type of equipment or industry. This looks at the overall risk from a facility.
Okay, there's one more question from Scott before we move to the verbal questions. It says, has APCD considered recent changes to CARB regulations, including adoption of an additional 700 plus toxic air contaminants and use of total PM rather than PM10, as is the current practice? And how will that pull in additional facilities and re-engage those that made reductions in the future?
So that's a good question. That I think you're referring to the CARB regulations that refers to emission inventory requirements. And again, I think this was probably not described in detail in this presentation, but we did it in the Air Toxic Hotspots annual report, that the health risk assessments are conducted in accordance with the guidelines that is provided by the state toxic experts, the Office of Environmental Health Hazard Assessment. And we do use the models that are approved by federal EPA. And therefore, so any changes that comes around from these additional regulations will be evaluated and incorporated into the health risk assessments. Not all those 700 toxic compounds have actually health risk values. So not all of them are going to impact the health risk assessment. And until those health risk or unit risk factors, whatever you call them, are developed by the state, they're not going to have any impact on the health risk assessments.
Yeah, I believe Jack Monger has a question. He has his hand raised.
Thank you. Can you hear me okay?
Yes.
Yes.
Thanks, Moses, and thanks, Mining. I just want to piggyback on one of the earlier comments with regard to using technology in the public notification process, and ask that you consider for those public meetings, when there's a case of a public meeting, and I'm really saying this based on past experience. There's sometimes where there's a strong representation from the public, and then there's times where there's one, maybe two people, and that's from personal experience. So I think it might be wise, if it looks like there is very little public participation, to consider alternative, like a virtual meeting like this or something like this, rather than requiring the expense that's necessary for renting a room and scheduling all that, and having people attend at that particular location. It would seem to be wise and resource saving to consider doing something on a virtual basis when the public interest is low.
Thanks, Jack, for your comment. And actually, for the time being, we are doing virtual meetings, and we'll have to see how in the future things might change. But there are advantages and disadvantages for having a public meeting in one form or another. And I think we will evaluate all those options. As you can tell, right now, there is no specific requirements in our rule pre and post this proposal that prevents us, for example, to hold virtual meetings. And therefore, due to COVID, we actually had to do it in a virtual format, but that was not inconsistent with the requirements to hold a public meeting. So we will take into consideration what forums are available. I think Diane also had some suggestions about what type of public meetings can be used, and any input from you will be very helpful and appreciated.
And, just to add to that, the provision and the proposed rule that discusses the public meeting requirement does say that a virtual public meeting might be conducted with approval from the APCO. So that's actually in the proposal. And so, I mean, the thinking here is that it can be pretty convenient for members of the public to attend meetings virtually. Most people, a lot of people have full-time jobs, and, we have these meetings in the evening. So, I think that we're certainly receptive to the idea, because we feel that it makes sense, and it brings convenience for members of the public.
And it improves public participation in some cases.
Thank you. May I have a follow-on question, or is there other people in line?
Go ahead.
Thank you. With regard to what was called for in that meeting back in May of 2019 that you mentioned, when this subject first came up, the several members of the board at the time asked for a recommendation, but also asked for other options and what those options would mean. I heard you mention earlier that you had considered other options, but I haven't seen any data, or perhaps you have some data that you could present to show why, for example, an incremental movement to ultimately to get to 10 in a million, that might start at 75 and then some years later go to 50 and so forth, particularly as technologies become available for those facilities to be in compliance. But do you have some other data with regard to those other incremental options, and how they stack up against versus going to 10?
So we do have data based on the facilities prepared health risk assessments and those that we have already approved, and those information will be available publicly. So, and the facilities actually know that number, so it's not a secret to the industry who is impacted by this. But I think we did explain the reason that we felt 10 in a million was the appropriate risk reduction threshold based on the fact that it does provide the same consistent standards that's related to acute and chronic non-cancer health effects, that once we notify the public that there is an elevated risk, there's a requirement that that risk be reduced as well. And it also has been adopted by many other districts and been implemented in that manner. So it's not the first time that we are looking at 10 in a million as a risk reduction threshold. But I think Miney wants to say something. I can see her waiting for me to stop talking. So go ahead.
Sure. No, I mean, I think that, we cover, the reasons why we are recommending 10 in a million. We believe it makes sense for our region, based on the nature of the facilities that we have and where they stand with regards to the health risk. Also, we believe that it makes sense aligning the public notification requirement with the risk reduction requirement, because it is very difficult to explain to the public that they are exposed to an elevated health risk, but facilities are not subject to risk reduction. I know we definitely feel there is a disconnect there. As Mosen said, this is being implemented by other districts, so it is doable. And most importantly, I think what we are saying here is that, I think everybody agrees that, reducing cancer risk is beneficial for the region. So, but, the rule also addresses that, we're proposing to decrease the cancer risk to 10 in a million, given that is technologically and economically feasible. So I think that's very important to mention as well. Because we want to make sure that, we would take into consideration where we are with regards to technology for some applications. And so, I just wanted to highlight that we wanted to decrease the cancer risk, but to the extent that it is technologically and economically feasible.
Okay. Thank you, Jack. We have another verbal comment from Ali.
Hello, thank you for your time today, ladies and gentlemen. I want to discuss something. I'm in the dry cleaning industry, and as Mr. Nazami said, as far as the PCE and TCE chemicals, me and my family had a dry cleaners, and there was a lowering of standards done, and which had brought our landlord to basically sue us and kick us out of our business. Most of my family members had to file for bankruptcy because of it. We didn't have any choice about it. It was just a lowering the standards, and we were kicked out and lost our whole life, basically. I am still in the industry, and what I've learned is I've come across again with environmental companies that do take advantage of small business owners like myself. What I have learned is, and again, I do have a biochemistry background, and I want to ask you guys something, please, to really understand. This is a probability that you are going off of. There is no way you guys can concretely say factually that these industries or these emissions cause cancer. The biggest cause of cancer is genetics, ladies and gentlemen. You have a predisposition. It is almost impossible for you to tell us that from these emissions you can pinpoint that is what's causing the cancer. Having a 10-fold increase in the part in the 101 million, it's undoable. You're going to cause a lot of business and industries to be affected. I think this is just another way to have the regulators come and cause bad scenarios for especially small business owners that don't have any other choice. So what I'm asking you is, can you prove that these are causing cancers? And can you also show us how lowering, once again, is going to decrease the cancer cancer risk? Thank you.
Thanks, Ali, for your comment. That's a good question. Actually, the compounds that we are analyzing in the health risk assessment have been extensively studied by air toxics experts, scientists that have done studies that determine that these are cancer-causing agents. Now, the question is, do you have to wait until people start dying to decide that you're going to take action, or are you going to take precautionary measures to prevent the risk from contracting cancer other than non-voluntary risks? The genetics and diets and lifestyle are all decisions that people can make. Genetics is not, but the others are. But you don't have a choice than to breathe air. And if the air that you breathe contains toxic compounds, then that's why we are here to protect the public health and to clean the air in San Diego County. So it is different than saying, well, since there is such a high cancer rate, then let's not worry about these sources. The other thing to keep in mind, Ali, is that this is just a risk from one facility. And we're not talking about the cumulative risk, because if you add these 10 in a millions and hundreds in a millions by number of facilities that may have toxic compounds and add them all up, then they'll add up to like that number 760 in a million that Cal EPA estimate based on the toxic compounds that are present in the air in California. So we are doing something that is required under state law, and we are using the best science and best information available. And as we move into the future, the information advances, and as it becomes more robust, we continue to use the best information.
I appreciate that, sir. But again, there's not a doctor on the panel. With all due respect, I understand you guys are engineers, but it would be great to have a doctor on the panel to be able to confirm that that's what's caused. Again, this is all speculative. You guys cannot concretely tell us that this is what's causing it. It's a probability. There's no factual way to confirm it is coming from these facilities or from those compounds that you guys are including. And this decrease, a tenfold decrease, it's unbelievable. There's no way the facilities are going to be able to keep up with this. And I just do not agree with it, because I don't think you guys can prove that it will decrease the amount of cancer cases.
And you're absolutely right. There is no doctor on this panel, but we are not making the decisions of what compounds are toxic and which ones contribute to cancer. These are done by doctors and health toxicologists and health experts. We're just following the guidelines.
And just to add to that, this rule does not apply to small business as defined by state law. So as Mosen said, dry cleaning facilities, for example, they are evaluated, but there's a separate process. And so this rule, if you look at the applicability of this rule, it will exclude facilities such as dry cleaning facilities.
Yeah, I appreciate it. And again, I will not find comfort by making sure that my industry or my business is safe. People do have to speak up for other industries that will be imposed. This will be imposed. Again, I will end my discussion. I just want to make it clear. You guys cannot, without a doubt, tell us that lowering these emissions will lower cancer. If you can, please tell me right now that you will be able to prove that lowering these standards will lower cancer cases in these facilities. I don't think you'll be able to say.
Ali, again, cancer can be caused by many, many factors, and just looking at the overall cancer rates is not going to give us the ability to say, okay, well, since there are all these other factors that contribute to cancer, therefore we don't have to worry about stationary sources. Our district is required under state law and federal law to regulate stationary sources. And this is a state law requirement that if the sources are above certain threshold, they have to reduce the risk. Now, there is no question that in terms of criteria pollutant, there are actual standards that are developed by federal and state agencies that if you're above those standards, you're in non-attainment status, and below it, you're in attainment. Toxics are approached by health risk assessments. And that's the standard way of looking at toxics because the dose is the poison. So the higher the dose is, the greater the chances of contracting cancer. And that's what we are regulating here, the risk, not the actual number of people that are contracting cancer. Just if you have to, if you had the luxury of doing lab tests, which is how these standards for unit risks are developed, you would be only exposing to one source of emission and then decide whether it reduces the cancer or not. But unfortunately, we are exposed to many, many different sources. And we have to look at how we can minimize the risks by looking at all exposures from stationary and mobile sources. And this rule, again, is specific to stationary sources. There are other programs that are looking at other mobile and other stationary sources as well. But thank you for your comments.
Understood, sir. Can I just make, I'm sorry, one last thing. If there is going to be these law regulations, I also request that maybe you guys can consider some financial assistance to these companies or these business owners to be able to deal with the situation. Because like I said, some people like me, where the perchloroethylene was legal, there was no regulations back in the 70s and 80s. The regulations came afterwards and there was no way to deal with it after that fact. I just hope that in case if the standards are going to be lowered, that the standards of the APCD and the Environmental Agency will help financially with these other with these costs of remediation. Thank you, gentlemen. Thank you, ladies.
Thank you.
Thank you. Our next speaker is Suzanne.
Hi, this is Suzanne Sifright from California Construction and Industrial Materials Association. I had a question about the term economically practicable. It's a new term to me, and I'm wondering if you can provide some feedback regarding where that term came from and the rationale behind the 10% of annual profits of a facility or 1% of the annual operational budget of a nonprofit.
Miney, did you want to address
Yes,
that?
so the term is defined in our rule. In terms of the source, I will ask the team if they have more context in terms of the history of, how we developed that. But the term is defined in the rule.
Yeah, good evening, everyone. This is Jim Sweeney. The current rule has a slightly different definition of what economically practicable is. And in talking with our financial people, they felt that that was an outdated metric. And so what we have proposed now is the same thing that the Bay Area Air Quality Management District has in their corollary rule in terms of how we look at the economic impact of complying with the rule.
Thank you.
Thank you for your comment.
Okay, our next speaker is Jack. Jack, you should, oh, there you go.
There we go. It's moving on me. That button was in the middle a while ago and now it's down in the left-hand corner. Somebody's messing with me. Okay, sorry. I just want to follow on Ollie's comments because, that was really what I thought was requested of staff some 2 years ago when this issue came up, because the introduction by one board member of this 10 in a million was justified by everybody else is doing it. And as you all have both pointed out here tonight, all the other districts are not all doing it. There's a pretty good split among the larger districts in the California. So, and that never seemed to be a justification to us anyway, of just because everybody else is doing it, we should be doing it. But at the end of the day, the question was to be able to talk about how this really does benefit San Diegans. How does this really benefit members of the community? Is all that we can say is that it reduces risk. We can't say anything about likelihoods, and you showed numbers of other attributed cancer to the, just to the general population, to general everyday activities, which were huge, a couple of 100,000. So here now we're talking 10 in a million. I don't think the public really has been given a fair explanation of how doing this is going to make a difference in their health.
So I think, Jack, is that a comment or a question? I just want to make sure that I understand, if you're asking us something specifically or you're just making a comment.
It's more a comment, minding back to that whole thing we were, that what our expectation was about this report that will go to the governing board and what information it was going to include, and fundamentally being able to say that this particular 10 in a million versus 50 in a million versus 75 in a million, what those really mean for health, what they really mean to San Diegans in terms of their health. But I'm hearing your preference for 10 in a million for more almost administrative reasons, but not for reasons that really would make a difference for health. Or maybe there are, and I've missed them, but I don't. I wouldn't, if I was a member of the public, I wouldn't understand what's the real benefit.
Well, I mean, there is obvious benefit if the risk is reduced from 100 in a million to 10 in a million. Now, if your comment or question is just because other districts are doing it, we shouldn't be doing it. I think that the reference to that I made, Jack, was not to say, oh, so-and-so did it, therefore we're going to do it as well. But it was just to show that it is a risk reduction threshold that has been implemented and is achievable. We're not coming up with a number that nobody can meet, and therefore we're going to cause a lot of economic and other impacts to the industry. So that was the reason we used looked at the other districts, and 11 of them in California are already implementing this, and it looks like it is working. So that wasn't to say just because they're doing it, we're going to do it. It was to answer or address what in the world are you guys thinking? Because this is going to put everybody out of business, and that was not the case in other districts.
Thank you, Jack. We now have a question from Diane. You can unmute yourself.
Thanks. Well, I think Moisen said what I wanted to say in part, at least, which was, I think the benefit's obvious. And I wanted to respond to Ali's comment. My understanding, correct me if I'm wrong, APCD staff, is that the state of California has a panel of experts, scientists, medical doctors, and others who go through a prolonged multi-year process to determine what chemicals are considered to be carcinogenic. And then those chemicals are the ones that are included on the list. So I think it's really important that the public who's listening here and outside of here understand that this isn't a determination that's made by the APCD staff or even the governing board. This is a decision. These are decisions that are made outside of the district and that all of the districts within the state of California are subject to. So that's the first thing. And that these rules would apply to those chemicals that are listed. And so for those residents who live in close proximity to those facilities that are emitting cancer-causing pollutants, reducing the emission and exposure to those pollutants has obvious benefits. And I feel like no one has asked those residents if they were okay with being exposed to these levels of cancer-causing pollutants for these many, many decades. and that it's your job, which I feel like you're taking very seriously, to protect public health. And so that's what's happening here. And I asked the question about whether or not healthcare costs would be included in the economic analysis, which I don't believe it currently is. And I think it's really important because many people in the communities that are exposed to these chemicals don't have healthcare. And if they contract a serious illness like cancer, it's up to them to pay for the treatment, or they don't receive it and may have dire consequences as a result, or the government is paying for their healthcare. And so the cost is borne by all of us. So I do feel like it's important to understand that costs are not only focused on the facility that's being required to reduce the emissions. So I just hope that we can have a fuller discussion of what all the impacts are on people's lives. And beyond the costs of healthcare, when people are ill, they can't support their families. So there's an economic impact on their families as well as a result of the illnesses. So I just think it's a broader conversation. And I know we're talking about this in a fairly narrow way, but I think there's important questions that are being raised. And I just hope that we can continue to expand the conversation. And Mayuni's going to ask me, and yes, that was probably more a comment than a question, but if you want to comment, please go ahead. Thank you very much.
Thank you, Diane. And I just will add one minor thing to what Diane said, that the process that Diane, you explained about the scientific review panel, it's actually a very open process. And there are scientists and toxicologists and experts, medical experts of all means that comment into that process. So it's not just the 3 members on the scientific review panel or how many there are that'll make this decision. They actually go to public comment and receive a lot of input from other health experts before they make these decisions.
Great. Thank you, Diane. There is a question in the chat from Shirley Rivera. Revisiting the question and answer on economically practicable, what guidance or procedures is the APCD using for the criteria in making the determination of what is economically practicable?
So, I mean, as I said before, this term is defined in the rule. And so we would need the records from the facilities to demonstrate that, installing controls or other mechanism to reduce the health risk, is not economically practicable as defined by the rule. But, it's, again, we're going to need records from the facility to verify that. Any other thoughts from the team on that?
No, I think there is guidelines in the rule itself that defines what's economically practicable, but beyond that, it'll depend on the available information from the facility and other sources that have implemented risk reductions that could be used as reference.
Thank you. And Shirley now is raising her hand and would like to speak. Go ahead, Shirley. You're muted, Shirley.
There we go. Hi there. Shirley Rivera, following up on my written comment. I'm with Resource Catalyst and am supporting and working with Environmental Health Coalition. So my comment regarding economically practicable is tethered to the Section E, the risk reduction audit and plan. And the more nuanced element of the question I have is if in fact there's something that is a step-by-step guideline or procedures so that at least in evaluating what's economically practicable, both the district and the facilities that are making that demonstration, have some consistency, as well as the fact that if there is interest from the public to understand what has been looked at, whether it's capital costs, operating costs, other externalities. So that's the reason for that question. Is there a document or documents that can be pointed to? I heard you reference that the Bay Area is where the 10% annual profits and the 1% operating for nonprofits was provided. So I'll ask a follow-on question. Does the Bay Area have a guidance that you all intend to use as the template, if you will, for what should be considered in economically practicable in that analysis?
Sure. Surely I can handle that. I don't know what criteria exactly Bay Area uses for this, but because we're looking at the annual profits of a facility or the annual operational budget, we would need information from the facility on the costs of implementing the risk reduction measure, both the capital and the ongoing annual costs. We would calculate an annualized cost based on that, most likely similar to how we do for best available control technology analyses, and then compare that annualized cost to what the annual profits are or the operational budget, depending on the type of facility it is.
Okay. Thank you. I will sort of gather my thoughts, and if I have other follow-on, I'll raise my hand or put it in the chat. Thanks very much.
Thank you, Shirley. Is there anyone with oh, there is someone in.
There's a question in the chat, Angela.
Yes. From Sam Peterson, has there or will there be any analysis of expected emission or risk reductions that could be expected over time from the changing of the threshold from 100 to 10 in 1 million?
So there will be data available as this, if this amendment is adopted by the board, there will be data available on which facilities are subject to this risk reduction threshold, and whether or not they would have had to do anything under 100 in a million versus 10 in a million. And that data will be tracked by the district per facility and will be available, as you heard Miney mention, by the end of this year under AB 423, Assembly Bill 423. We are going to post all of the air toxic hotspots data that we have and information on our website. So it will be something that can be viewed and looked at on our website.
Yeah. Oh, Shirley's hand.
Okay, I learned how to unmute myself. There we go. This will be a comment or a request. I would be interested in seeing an example or two examples or any examples you have of an analysis where the district has made a determination of what's economically practicable. And actually, let me broaden that to say, where a facility has conducted an analysis, I'd be interested in seeing that, and then any follow-on evaluation that the district has done of that kind of analysis, if that's available. And I can send my email address and also put this in writing if that's helpful.
Thank you, Shirley. We actually have your email address,
right.
But I think the short answer is, and I'll let Miney answer it better than I, is that no, we have not done this analysis before because nobody has ever been subject to risk reduction under 100 in a million in San Diego. So therefore, there is nothing available to show what the economic impact or economic practicability was. But as we move forward and we have any sources that may be subject to this requirement that cannot reduce their risk below 10 in a million in a 5-year span of time, then we will capture that kind of information and will be available. Yes. Sorry, Maini, go ahead.
No, I mean, I think beyond that, this is a provision that is being proposed. So, I mean, obviously we're not applying this provision yet. So we don't have an example of what we're proposing here because we haven't done it. The rule has not been adopted. But, typically for risk reduction, what happens is that an application is submitted. As Mosen said, we're not processing risk reduction, proposals for cancer risk because nobody in the county is above 100 million, which is a good thing. But we do evaluate risk reduction for, acute and chronic. But typically the proposal comes in a form of an application. And that's what we're envisioning for this, is that if a facility is subject to risk reduction, then we would evaluate through an application because that typically requires changes to the operation, which would require an application anyway. And so, and that has already established framework for the evaluation. If we get an application, we already have regulatory requirements with different timeframes and things like that. But I think we don't have an example of this because, we haven't applied this provision that's still proposed.
Okay, thank you, Shirley. The next speaker will be Sarah.
Yeah, I want to follow up on Shirley's comment and maybe just a question, but then if I understand it correctly, without guidance of this type, you could in theory have two facilities with the same risk and the same source, but have vastly different costs that they would be held to for correcting a problem, correct? Depending on who at the district evaluated at what point in time and the annual profits of that organization or their nonprofit status.
Well, I think you're correct about the variation between facilities, but who in the district evaluates it shouldn't make any difference.
Well, without policies or procedures in place, how can you ensure that it's done consistently? I mean, I'm concerned that you could have a situation where it would be reasonable in one situation to think a person could spend $10,000 for a filter, and in another case, $100,000 or $100 million for a filter. And it all depends, right? So how are you going to ensure consistency in terms of what's economically practicable?
Well, the risk reduction plans are not something imposed by the district in terms of what measures the facility has to take. So we will actually evaluate what the facility tells us that they're going to take this approach to reduce their risk. So they can choose a process that costs 100 million or 10,000. We're not going to dictate that. But if the process has been implemented by another facility and they're similar type of operations, let's say they're both spray booths or they're both some sort of equipment, combustion equipment, then there is data available to make that kind of comparison. And so we do this all the time in rule development process also for criteria pollutant. When a source is required to meet certain emissions limit, if they argue that in order for us to put in a Cadillac SCR on our unit, it costs $10 million, but other same type of equipment has installed SCRs that cost maybe $100,000, then we have that type of information available to share with the source and to make sure that there is consistency.
And I just wanted to add to that to say that this is a proposal. So if there's a suggestion on how to enhance that, or, I mean, we try to define the terms so that there's some clarity as far as what we are proposing. With regards to the risk reduction process, it typically occurs under an application. So we already have a very well-established application process, and that's how we permit sources in the county. So, but with that said, this is why we are here. We are proposing something. And so if you have suggestions on how to enhance these provisions, that's why we wanted to hear from you, and we'll certainly take all comments into consideration. We do want to propose a rule to the board that it's very clear, so that, again, we can fully implement all the provisions.
Thank you.
Sure. Thank you for your comment.
Okay, we have a question in the chat from Neil Davenport. Will the district requests for a risk reduction plan be issued before, during, or after a facility's public notification process? Do proposed rule amendments establish when the district will issue either request relative to approving an HRA? What is the district's rationale for shortening both timelines for facility response? Under the circumstances, it would seem that all parties are embarking on something new and will need more time.
So thank you, Neil, for your question. I think the question of timing, it will really depend on the adoption date, and implementation will certainly be after the rule amendment takes place. And therefore, for facilities that are undergoing health risk assessment review and approval at the time when the risk assessment is approved, if there is risk above notification and risk reduction levels, the facility will be notified and requested to provide both notification and risk reduction. And then upon review of other facilities that have previously approved risk assessment, then those facilities, if they're exceeding the risk reduction threshold, will be required to provide or submit a risk reduction plan. As far as the shortening the time, we're actually shortening it for both the facilities and for the district to review this. And the main reason for that, Neil, is because if you look at, and we did this in the presentation in the annual air toxic hotspots report, if you look at the process that exists today, it takes multi-years from the time that we even find out that a facility has elevated risk to require a facility to do public notification and to submit a risk reduction plan. And then there is another 5 years or potentially longer to reduce that risk. So you're looking at a significant amount of time that if the purpose of this rule is to protect the public and reduce the toxics and risk associated with the operation of a facility, it takes multi-years before we even start to see any risk reduction. So we felt that we should do whatever we can in terms of getting the process streamlined. And state law actually allows the process to be shorter. It just says it can't be any longer than this. So we are taking that concept into consideration and making the timelines a little bit more realistic so that we can get to the end point is not just to go out and tell the public the sky is falling and then say, okay, now that's the end of it. The end point is to make sure that if there is a high risk, that the risk is under consideration for risk reduction. So I think that this will help to expedite that process.
Also, the timelines, again, we're open to your suggestions. This is just a proposal, but the thinking there is that those timelines, they're established in the 90s. And when we didn't have, emails or, cell phones and other means of communication. So it took more time to exchange information via mail things of that nature. So we feel that now we don't need, 30 days or 45 days. So we're just trying to streamline the process, as Mosen said. But it is a longer process because, as Randy said in the beginning, Rule 1210 is just implementing the requirements under the hotspots program. So it starts with, emission inventory, then we quantify emissions, and then we establish which facilities needed to be evaluated. We request a health risk assessment. The health risk assessment quantifies the health risk and all these requirements under state law. And once we approve the health risk assessment that is conducted by the facilities, that's when we notify facilities whether they are subject to risk reduction or public notification requirements. And then that's when the clock starts for both requirements, to notify the public and to submit a proposal for risk reduction.
I believe Neil has a question, and then Shirley and Jack. I'll let Neil speak. Neil, if you could unmute.
Thank you for answering the three questions. But the common theme in my questions was just the obvious thing that I think the district's workload is going to go way up. It already has potentially. And I think one of the themes coming from industry and the public is we don't have a sense for the timing of your actions, how you're prioritizing what appears to be dozens, if not even quite more, facilities that you are going to be taking action on, whether it's the risk assessment step leading into public notification. And, industry is going to want to be ready and responsive. But I guess my concern is you're going to be so backlogged that so much time could pass, and the ability for all parties to kind of be efficient in the actions they need to take might be jeopardized.
Well, thanks for your comment, Neil. And we do agree that we will have a workload that is going to increase. But again, this is a program that has not been implemented in San Diego as required under state law for a period of time. And we are trying to play catch up here. And by doing that, I think we are providing the necessary oversight of making sure that facilities that have high risk associated with their emissions are properly notifying the public, and then if required, then take necessary steps to reduce that risk. And by shortening the time frame for some of the reviews and administrative processes associated with that, we think we're doing whatever we can to help. But again, if you have some suggestions that will make this more practicable, I'm using the economic practicable term, we're more than happy to consider your comments.
Great.
Angela, did you say? Yeah, go ahead. Sorry.
Yes, I'm sorry. Our next question will be from Shirley.
Okay. I almost put my hand down after Mose and you were starting to answer, and just sort of the context of Neil's question. But I've decided I'm going to ask the question, even though I was going, oh my gosh, maybe my question is obsolete. So what I did appreciate, I'm going to connect the dots to the recent workshop that the Air Agency hosted last week that described the permit process. The application comes in, 30-day review, completeness, and then the district has a certain amount of time to process those ATCs, And the reason why I want to bring that up is I'm wondering whether and how, and I think I already know what the answer is, but what is lovely about the risk reduction audit plan, in the sense that there will be, actionable activities to reduce risk, is that these sources will be going through your permit process to make that happen. I'm wondering if the district is looking at kind of moving some of those, considering to move those up in line, or some kind of expedited permitting, to further facilitate having these reductions occur sooner. And I realize, again, you haven't done this before, but I want to connect the dots with the risk reduction part of this and just your overall permit processing. So, Mayani, I'll go ahead and stop talking. It looked like you were going to start.
Well, it's again, so just to clarify, we have been processing applications for risk reduction, but not for cancer risk, right? But we do have a few applications, in fact, for to address risk reduction for cancer, for chronic and acute. So, the risk reduction evaluation comes through an application because facilities needed to make modification to their processes in order to reduce emissions and consequently risk. So, again, that's how we're proposing to evaluate these health risks. But so it's very much connected with the permitting process because, it is part of a change that needs to be made to the facility. But, and we do have already established timelines for the application process. Whether it's for a risk reduction or anything else, they would all be subject to our Rule 18, which has, different timelines for various milestones with regards to the process. But I'm not quite sure I'm answering your question. So I don't know. Please feel free to let me know if I'm not addressing what your comment is.
I think you're addressing part of it. Procedurally, I understand that you'll be able to do the same thing. I think the added piece is if these types of facilities, the types of proposed actions can be assured that it can kind of move through the system, quickly. Because, part of this is being able to have the projects get up and going to realize the risk reduction. And admittedly, sometimes the permit process can be rather protracted. So no disrespect, but, just things happen. And I just want to, and that's the comment. I just want to see if there are opportunities to assure that, those who go through this will actually also be able to move and expect, the opportunity to install and move forward with their reductions.
Understood. No, and it's a good point. The current leadership team at the district is certainly committed to address the backlog issue. We do still have a backlog, with regards to permit applications. We've been made a lot of progress during the past year, but we still have some work to do. We've made some changes in the team. We've made some reassignments. We add new engineers to the team, for the purpose of addressing this backlog that we have. Certainly, these applications will be prioritized because of the importance of the outcome. Now, I have to be honest, these applications, it's not going to be like processing an emergency engine app that you can do very quickly within a few weeks. They are going to be, I think a lot of them are going to be complex applications that we're going to have to take the necessary time. I'm not saying we're going to take our time. I'm saying they need to be done and they need to be correctly done. So, some of these applications can be very complex because we needed to evaluate best available control technology, and if the facility is in fact proposing everything that can be done for the purpose of reducing the health risk. So a lot of analysis is going to have to be done, with regards to what's being proposed, and then making sure that proposal is going to in fact reduce that health risk. So you have our commitment that we fully understand the importance of these applications. Also, the importance of reducing our backlog, and we're working towards that. But again, these applications, they're gonna, take longer than, the typical applications that we process, just because they'll tend to be more complex.
And at the same time, Shirley, we're not expecting to receive hundreds of applications for risk reduction plans. So there will be a limited number of applications, and the management will keep a very close eye on those limited number of applications to make sure they move through the process expeditiously.
And the public, can track that as well, because, these applications are subject to public notification. We're supposed to send out notice when we receive these applications. In fact, we have sent recently a couple of notices, again, not for cancer, but for, other type of health risks. And, we're certainly also trying to increase transparency, and all the information is going to be available for review. So, the public should hold us accountable, and stakeholders should hold us accountable with regards to the progress that we're making in those applications.
Thank you very much. I appreciate that, Mosen and Mayani. Thank you.
And just add one thing to that, as Miney said, we do post the risk reduction applications on our website. That will be under the permit-related notices, but it's also listed on the page that we put the link in the chat for.
Okay, thank you.
Okay, thank you, Shirley. Next up is Jack.
Great, thank you. Can you hear me okay?
Yes.
Thank you. Sorry to have to ask that every time, but I just it's kind of a brief question, but it may be I'm hoping it's a longer response, and that is, in the course of your review, were you able to determine why South Coast and San Jose or San Joaquin Valley, two of our most impacted air districts in the state, chose to keep their risk reduction thresholds at 25 and 100 respectively?
I used to work at South Coast, so I can speak for South Coast. South Coast is has the center heart of industry because of the two ports of Long Beach and Los Angeles, where more than 43% of all commodities that comes into the United States comes through those two ports. So there are significant sources of both goods movement, and half of the total refining capacity of California is in South Coast. And therefore, there are very large industries that are required to provide the economic engine of the whole country through those ports and through the refining capacity of reformulated gasoline for the state of California. So when the risk thresholds were adopted in the early 1990s, they were established based on what was available at the time. Now, whether or not those risk thresholds are still valid numbers in terms of should they be reviewed and revised, I think you have probably, if you look at the South Coast rule, for example, they have provided some additional avenues for facilities who voluntarily want to reduce their risk to be able to do that through a more lenient process than the requirements for risk reduction. But South Coast also had the two largest, or the only two, lead acid battery recycling facilities west of Mississippi. So there was a lot of very, very high toxic sources in South Coast, and reducing the risk to 25 in a million was a complete process of reducing the overall stationary source risk in that region. And again, whether or not they should be revisiting it, that established some 30 years ago or 20 some years ago, I think that's a question you should ask South Coast.
And conversely, I used to work for San Joaquin. So they made a conscious decision in 2015 to stay at 100 in a million. that was based on a couple of different things. One, everything they do under their air toxics program, but also one thing about San Joaquin is they don't have the population density that the more urbanized areas have. And most of their higher emitting industries are not near the population centers that they do have. And so they made a decision not to change their threshold. And the rationale for that is on their website.
All right, thank you.
Great, thank you, Jack. The next speaker is Lori. Please unmute yourself.
Hi, I was actually going to ask the same question that Jack had, in trying to realize the rationale that if South Coast hasn't and isn't looking at their reducing of their threshold in 30 years, it's just kind of interesting for us. So I really would like you to provide those details. I mean, originally when we went to the governing board and we asked for a technical report and analysis, those details need to be presented and put into a report as your justification as to why you're going to 10. I'd also like you to include in that analysis, in that technical report that was required, of looking at all of the other districts that are at 10 in a million. Many of them, there's significant amount, but many of them are in outlying areas. Central Coast in the Northern California. There's other ones that have no limits because they have no sources. And I would like a comparison as to how many industrial sources that are at districts that are at 10 in a million compared to what's in San Diego. Even just numbers. I mean, you can't say that that 11 districts or however many have 10 in a million, but they don't have industrial sources. So do some type of analysis to justify as to what it is that the rationale between San Diego and those other districts. I would also like to, in that analysis, have you guys specify throughout this whole workshop, you have consistently said you believe it's obvious, but I want scientific data, right? Yeah, it might seem obvious that you reduce the risk, but provide me scientific data as to why reducing that risk threshold is really going to provide a benefit to the surrounding community. And you need, however you're going to go about doing that, but in that technical report, you need to provide why that is going to happen. So I actually have 3 comments. So that's my first kind of chunk together. If you guys want to respond, or I can defer and you guys can work on it and come back in the workshop report, or however you want to do.
So Lori, thank you for your comments. I think we kind of covered these 2 questions before, and we will take your comment into consideration.
Okay, but I want something in writing. Okay, as the board, as the previous governing board said that you would do, it needs to be a written report. I made those comments to that governing board and they agreed, and it needs to be a written document. So my second comment is in line with previous comments of a glide path. Bay Area took the glide path and they went to 25 in a million and worked into it, address the facilities, the higher facilities, and address that issues. They've been doing that, I don't know how long, 10 years or whatever. And now they've recently reduced to 10. So the governing board, the previous governing board, said they wanted options. So why isn't that we can have that same similar glide path that Bay Area did? Pick 25 in a million, focus on those facilities, and then go from there. Just my other, right? Oh,
so
go
Lori,
ahead.
in regards to how the Bay Area rule works, they didn't specify that facilities had to get below 25 in a million and then change and make it to 10 in a million. They required everybody to go to 10 in a million, but they started with the facilities that were above 25 in a million. And so it just was how they wanted to approach the number of facilities that they had. So it's not that they had one threshold and then a second threshold. It's they went from 100 in a million down to 10 in a million. They simply prioritized the higher risk facilities first, and they used the 25 in a million as their threshold for a higher risk facility.
Okay, so you all at the district have so much on your plate. You've had so many personnel changes and everything that you're addressing. Why don't you do that in an incremental step? Give yourself some breathing room, focus on the high ones, and then go lower. Right? And that
Sorry, we are gonna take your comments into consideration. We are running out of time, and you know, I want to make sure that others have an opportunity to you know, ask questions. But we'll certainly take your comments into consideration, and we will be publishing a workshop report.
Okay, well, my last comment goes in with the compressed timeframes of the public notifications. It's the same thing. Why don't you go with state law? Use that's implemented in state law. Give yourself a little bit of breathing room. There's not a lot. And then in a year or two, come back and open up, go to the governing board and say, hey, okay, we can handle it. We can compress the times, and we can go forward. But don't put yourself over a barrel of committing to all these times. It's not just industry, it's you that have to get all this stuff done, and your staff and everything that you guys have. And I want you guys to be able to be successful. Okay, I'm looking at your guys' benefit as opposed to, and not industries. I mean, yeah, industry would love more time, but you guys need to meet all those timeframes as well as industry. And if it's state law that is a little bit expanded, take that breather and then implement it in a couple of years if you really think you can implement a shorter timeframe. So
this timeline, right, these timelines are not in state law, but we'll certainly take your comments into consideration. Thank you very much. I see another comment from Sam about prioritization scores. You know, at this point, the prioritization procedure is not being revised. So we'll continue to use the same threshold to, you know, request the health risk assessments. Angie, do we have anything else?
I do not see any more comments or in the chat or people are requesting to speak.
Well, I want to thank everybody for participating in this public workshop, and thanks for all your comments. We will certainly take all of those comments into consideration, and we will prepare the workshop report and move from there. Wish you all a happy evening and nice weekend.
Thank you, everyone.
Thank you.